everyone. Welcome to the Pharmacist virtual learning experience. Before we get started, I'm going to read this disclaimer that you can see on your screen. The Pharmacist virtual learning experience brought to you by Mandel's Clinical Pharmacy is intended only as an educational program for patients. Any clinic-specific information shared by the nurses is the opinion of the nurse and is not intended to replace the recommendations or requests of your healthcare professionals. All medications will be dispensed by Mandel's Clinical Pharmacy according to the prescriptions as written by the provider. Again, everyone, welcome to the Pharmacist Virtual Learning Experience, an educational program created by Mandel's Clinical Pharmacy to bring you together with outstanding healthcare professionals right from the comfort of your home. And the Pharmacist takes place every Monday at 7 p.m. Eastern Standard Time. Tonight, we'll be providing a live medication instructional program on 3 fertility products, which are going to be Gonal-f, Del-estrogen, and HCG, including an interactive question and answer throughout the program. Please join us via Zoom or Facebook Live, and we invite you to be part of the discussion by sharing your questions in either format. We are joined by various amazing healthcare professionals each week from across the nation to provide you with real-world experience, just as if you were sitting across from the table from them in the clinic. Today, we're joined by Laurel Meyer, and thank you again for your time and interest this evening. And now I want to turn it over to Laurel.
Hi, everyone. My name is Laurel Meyer. I'm in California. I'm an IVF case manager. So tonight, as you have been told, we're going to go over the Gonal-f pen, Del-estrogen, and the HCG trigger shot. And question and answer after every video. Focus your questions on how the medications are used, how to draw up and give, the side effects, and the reason that they're given. All those are very fair questions. And if you have specific questions about timing or dosing, please focus those questions back to your healthcare provider. So these videos from the Pharmacist program are always available at mymandelsPharmacy.com. They can also be found on the Mandel's Pharmacy Facebook page and on YouTube. So to get started, I'd like to share a story about how I became interested in becoming an IVF case manager myself. About 25 years ago, my husband and I started having trouble getting pregnant. And we started with infertility with Clomid, did several cycles of Clomid without success. We then moved to IVF. We did a couple rounds of IVF. Unfortunately, this was also unsuccessful. However, while we were still reeling from the bad news of that last IVF cycle not working, we got a call from a friend who was a labor and delivery nurse. She had a patient who had a baby, and she was not ready to be a parent. She was wanting to find parents for her baby, and my friend told her about my husband and I. She wanted to meet us, so we went down to the hospital that day, and we met her and her baby. And after lengthy discussion, she chose us to be her parents. So the next day, just a day after finding out that our IVF didn't work, we took home our baby girl. It was Valentine's Day. So quite a shocker. Then 4 years later, we wanted to expand our family, and we were going to adopt again, but we had an adoption that fell through during that time, which was devastating, but I won't go into that. We decided to use, to be the recipients of an adopted embryo. And so it was a frozen embryo transfer cycle, and the embryo had been donated to the clinic, and I was the recipient. This transfer happened, and it was successful, and I had another baby girl on the 4th of July. So now I have 2 holiday babies, and they are now all grown up. They're 17 and 21, and this is them, Sydney and Megan. So my journey was very long and arduous, and I didn't know how it was going to turn out, but it worked out with that perseverance and taking it one day at a time. So the reason why I tell this story is because I just want you to know that you're not alone. There's thousands of people, thousands of couples going through this right now. And I encourage you to reach out to family and friends and others going through IVF or infertility and share your story and hear theirs. And hopefully that gives you the courage to continue on your journey toward building your family. I wanted to also tell you that this, my story has a lot more ups and downs than I shared. And if you'd like to hear it in all its detail, you can go to mymandelsPharmacy.com, go to the Behind the Shots tab, and you can see several stories, including my own, or you can go to YouTube and type in Behind the Shots Laurel's story. And you can find it there too if you want to watch it in full detail. So tonight, my goal is to help you gain the courage and confidence to give yourself your shots. And I know that very soon you're going to feel like a pro. So if you could start the first video, it is going to be on the Gonal-f pen. Thank you. Hi, my name is Laurel, and today I'm going to demonstrate how to use the Gonal-f pen. The Gonal-f pen is a really cool little pen here. It's super easy to use. All you have to do is dial your dose that the clinic has told you to take. And if you go too far, you can just dial it back. You can go back and forth. It's not going to hurt the pen. So just find your dose. A typical dose is 300 units. So that's what I'm going to demonstrate today. Not sure if you could see that very well, but there's 300 units. You take your needle, pull off the tab. There's a needle on this side, which goes in to access the medication. You twist it all the way on, and then you pull off the outer two caps. You find a spot in your tummy, anywhere in your tummy, as long as it's at least an inch away from the belly button. And you don't want to inject into a spot that already has a little bruise or any soreness or redness from a previous shot. You're going to find a spot in the belly that has some fatty tissue that you can squeeze. You're going to squeeze the belly, go straight in like a dart, let go of this squeeze, and inject the medication. It will click, 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 click until it's already all instilled. In the little window, you will see 0, and you'll know that you're done. So you wait 3 seconds, have a Kleenex handy, pull out, and hold your skin. If after about 10 to 15 seconds, your skin is dry, then you're done. If you do notice some medicine leaking out or some bleeding, which can happen, it's not something that is a problem, but you just need to hold your skin a little longer until it's dry. The pen now has a medication still left in it, so you don't want to throw that away. You want to take your large cap, slide it on there, twist it off. This part will go in the sharps container, and then the cap goes back on the pen, and you can put it back in the refrigerator for the following injection. And that's all there is to that. Okay, Morgan, any questions come in on the Gonal-f pen?
Yeah, the first thing is you kind of briefly mentioned it, that if you over dial, it's no biggie, you just kind of go back. But what happens if you accidentally give yourself the wrong amount of medication, like too much? So if your dose was like 150 and you actually gave yourself 200, 225, what should the patient do?
So if you do give yourself the wrong amount, the first thing you need to do is just call the clinic and let them know. That's the key. If you give yourself too little, obviously you're going to give yourself the remainder of your dose. But if you give yourself too much, you're going to need instructions on what to do next. Your clinic may tell you to just don't worry about it, continue on with your appropriate dose the following day, or they may have you reduce it a little bit. So it's going to be up to the clinic, but it will not ruin your cycle. So there's nothing to worry about with that, but just to have that good communication with your nurse or your provider so they can give you instructions on the next step.
Perfect. I think that's what you said. It's not going to ruin their cycle. The stress they probably put themselves in is worse than messing up one dose. Another question is, so usually Gonal-f is come and it's in the box and it's cold. How do you propose to travel with the medication if they're out of town or if they have to travel to their clinic, or if they're home after giving a dose, how should they store it?
Okay, so Gonal-f can be stored at room temperature. Room temperature is considered 68 to 77 degrees. It can be stored at room temperature for up to 3 months. However, if it's kept in the refrigerator, it is good until the expiration date on the box. So my recommendation would be to keep it cool. It's going to last longer. However, if you know you're going to use it up right away, which you most likely will, it's okay to keep it at that room temperature below 77 degrees. No problem while you're traveling.
Beautiful. And then another question would be, if a patient, if they don't have enough medication left in their pen, let's say they have 75 units left and their dose is 150, what should they do?
So if you look at the pen, and you can tell by looking here at the increments how much you have left, and you notice that you don't have enough for a full dose, you have two options. You can either take this pen, which doesn't have enough left in it, put it back in the refrigerator, get a fresh pen, knowing you have enough, dial your dose, give your shot, you're done. Or you can take the pen that doesn't have enough left in it. You always want to dial a full dose in the window, give your shot, and then you're going to take a look at the window. If the window does not say 0, that means you still have more medication to give. Whatever is in the window is the remainder of the medication that you need. So you're going to take a new pen, dial your new pen to that number, put a new needle on, give yourself that second shot to complete the dose. And so there's two options there. Depends on how afraid you are of giving yourself 2 shots.
No, that's great. And I guess it kind of leads to also some of the Gonal-f pens will have overfill in them. So can you kind of touch base on, if they hear that, what that means when a pen has overfill, if their clinic says that to them, or if the pharmacy tells them their pens have overfill?
Yeah, so you never ever want to get rid of the medication, the overfill. Every Gonal-f pen has 100 units of extra medication in it, and this is considered overfill. You can use that. There's nothing wrong with it, and it's going to save you money in the long run if you take advantage of using that overfill. So my recommendation would be just dial your full dose each time, give the shot, and if it doesn't read 0, then go ahead with another pen and dial to that number, give yourself the next shot. And then you know you're using the overfill of every pen and you're getting your money's worth out of it.
Beautiful. Okay, I don't have any other questions that have come in. Anything else you want to touch base on Gonal-f, the pen?
Let's see. I would say just some helpful hints about making it sting less. You can ice the site a little bit beforehand if you'd like. It doesn't typically hurt very much. It's a very small needle and it's not a very irritating medication, so I don't think you're going to have problems with this. So next medication up, we're going to talk about Del-estrogen. This is used for frozen embryo transfer cycle to build the lining of the uterus. So Morgan, if you can cue this one up whenever you're ready, that would be awesome. Thank you. Hi everyone, my name is Laurel Meyer, and today I'm going to show you how to draw up and give your Del-estrogen. This medication is made by different manufacturers, and you can see by this slide that the vial can look differently depending on who makes it. It does come in 3 strengths, 10, 20, and 40 milligrams per ml. And the reason why I mention this is it's really important to check your vial and see what strength you have, and then let your clinic know what strength it is, and they can tell you how much to take. As an example, a typical dose is 4.8 milligrams twice a week intramuscularly. So if your strength is 10 milligrams per ml, you would give 0.48 milliliters. As the dosage or as the medication gets stronger, you give less. So with 20 milligrams, it'd be 0.24, and with 40 milligrams, it would be 0.12. And I'll show you how to find that on the syringe. So the main thing is just to make sure you check with your clinic, tell them what strength you have, and they'll tell you what dose to take and how often. Now, delestrogen is used to thicken the lining. It's typically used in a frozen embryo transfer cycle, and it thickens the lining so that it becomes a nice home for the embryo. We're going to talk about now where to give that shot. And there's 2 IM injection sites. There's one called the dorsogluteal muscle. This is the upper outer quadrant of the buttocks. If you put an X on your buttock cheek, it is the upper outer section. This site, you do need to aspirate, and we'll talk about what that is in a few minutes. The other site, the ventrogluteal muscle, is on the side of the body. And to find this site, I want everyone watching to find your hip bone, slide your fingers about 2 inches below the hip bone, right on the side of your body. And this is the ventrogluteal muscle. Slide your fingers 2 to 3 inches straight back from that site. This is the dorsogluteal muscle. Now, if your partner is finding the site for you, they can do as the picture is showing, find your hip bone, put their fingers under the hip bone, and spread the pointer and middle fingers apart to form a V, and this is the site. So this is the ideal site for several reasons. The ventrogluteal muscle is much bigger than the dorsoglute. It does not have any nerves or vessels that are large enough to puncture or to damage in any way. So this is considered the perfect site for an IM shot. It also can handle that shot that's given repeatedly for over several weeks, like the delestrogen is. So the next thing we're going to do is to draw up the medication. We are going to gather our supplies. You're going to need your medication, your 2 needles, one for drawing up and one for giving. And you'll want to look at them, and you'll want to see there's one that's thicker that you're going to draw up with, and one that's thinner that you're going to want to give it with. There's your 1 milliliter syringe and your alcohol wipe and a Kleenex. Okay, you want to have all these supplies ready. You want to wash your hands first, of course. First thing you'll do is take your cap off, alcohol the top of your medication. You want to do this every time. And then you get out your syringe and your 2 needles. You'll put the skinny one just on the table, and you'll get your thicker one and you'll put it on the syringe. So twist it on like that, and you're ready to draw up. Now, I'm going to use 0.24 as an example because this is typical. 0.24 is, if you look at your syringe, you find the 0.2 line and you count 4 little lines past it, and you put that amount of air in if that is your dose. So whatever your dose is, that's the amount of air you're going to put in your syringe. Take off your cap, put the needle in the circle in the very middle, and turn everything upside down. You're going to pull back a little, making sure that the tip of the needle is in the oil. Push your air in, and then draw back, and it will start to drip slowly down the side. And this is one of those times that you have to be patient because it will drip pretty darn slow. And as you can see, it's just drip, 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 sliding down the side. And you want a little more than your dose, and then you can push the air out. And you want the black line to end up right at your dose. So I'm going to go to the 0.2 plus 4 little lines, like that. Now you turn everything back up, right side up, pull your needle out, and then with a one-handed technique, you want to recap. The best way to do that is just to put the cap on the counter and slide the needle in like that and click it on. Now you switch to the give needle. And now you're ready to give the shot. So a couple helpful hints on how to make this shot less painful. You can choose to purchase a numbing cream or a numbing patch. Sanara is a numbing patch you can use. And if you use either of these, you won't feel the poke at all. You can choose to ice the site for about 60 seconds beforehand. That can help. And another nifty technique is the tickle technique. That's what I call it. So what this is tickling the skin next to where you're going to give the shot on either side as you're going in with the needle. And this takes advantage of what's called the gate nerve theory. And it will actually trick the skin into not feeling the poke. And it works very, very well. So what you're going to do is pick your site, and you want the muscle to be completely relaxed. So in order to do this, I would recommend just lying on your side on a bed with your partner next to you that's going to give you your shot. Or if you prefer to stand, you can stand with all of your weight on the opposite leg from the side you're going to receive the shot. So I would have a counter handy just for balance and put your toe on the ground for stability. And your partner can sit in a chair next to you. Or if you have to give the shot yourself, I recommend the same standing technique. Put all your weight on the opposite side from the side you're going to give it. And I would give it on the dominant side with your dominant hand. So if you're right-handed, it'd be the right hip. So with that in mind, now to give the shot, the tickle technique, tickle, 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 and you're going to go straight in like a dart at a 90-degree angle. If you've used the dorsal gluteal or the upper outer quadrant of the buttocks site, then you'll need to aspirate. And what that is pulling back on the plunger and looking for blood return. The reason you do this, although it is very rare, sometimes the tip of the needle can go directly into a vessel. And if the tip is in the vessel, you're going to pull back and see blood that comes into the syringe. If that happens, you're going to want to pull this out, switch the needle to a new needle, and go to a new site and give the shot. And it's okay to give the blood, the medication with the blood mixed in back to you because it's your blood and it won't hurt you. But if you use the ventral gluteal site, you can skip that step. So you go in, you just go ahead and give the medication. Once it's all the way in, wait about 3 seconds, pull out, and have a Kleenex handy to hold the site firmly. You want to keep your muscle relaxed this whole time. And then after about a minute, your partner's going to check the site. If there's any blood or medicine leaking out, you'll continue to hold the site until it's dry. Check it again, it's dry, you're all done. Everything will go in the sharps container. And then this will go back in the cupboard. You don't want to put this in the refrigerator, and that's all there is to it. All right, Morgan, any questions coming on delestrogen?
Yeah, first of all, the tickle technique, I've actually never heard of that. I've been doing this for like 10 years, so I'm going to take that back to my clinic as well. One thing is, someone wrote in and said that they're on delestrogen, but their friends aren't. A lot of their friends they've gone through fertility or not. So why do you think that they may be on it? What is the purpose of delestrogen, and what is it kind of doing to help with their cycle?
Okay, good question. I know that people get concerned when, people they know are on different protocols than they are. And I wouldn't worry about this. There are a lot of different reasons. The primary reason I think is that different providers have different preferences. They've had success with particular protocols. They like them. They're doing well with them. Their patients do well with them, and they like to stick with them. That's one reason. Another reason that you might find that delestrogen is one way of giving estrogen. It's intramuscular. It's typically given twice a week. There is estrogen tablets that you take orally. There's vaginal estrogen. There's estrogen patches that you can put on your buttocks or your abdomen. So there's so many different ways of getting estrogen into your body to build the endometrial lining. The delestrogen sometimes is given when your uterus is a little bit resistant. You've shown that it doesn't build up as thick as adequate, as good as it could be. And so this is a little extra boost of estrogen that you might need to get a thicker lining. So just know that your provider is picking a protocol that they think is going to work for you. And just also know that this is not an exact science. There's no right or wrong. It is something that each provider just does what they feel comfortable with, and given your history, will pick what's right for you.
Beautiful. And then typically, how long should patients expect to be on this medication? Very typically speaking, of course.
So typically, your provider will tell you to stay on this until 12 weeks of pregnancy. At that point, the placenta has taken over in creating enough estrogen and progesterone to maintain the pregnancy so that your body can do it on its own. But it does take approximately 12 till about 12 weeks of pregnancy. This is typically about 9.5 weeks after your actual frozen embryo transfer.
Perfect. And since patients are going to be on this medication or potentially on this medication for such a long time, do you have any tricks or tips to help? Because sometimes with the oil, you can get kind of knots, or just with the soreness they can have when they're given injections for such a long time.
Yes. Okay. Tips and tricks. Intramuscular shots are the ones that people are afraid of because the length of the needle is scary. The length of the needle, just so you know, does not make the shot any more painful. The nerve cells on the surface of the skin are where you sense pain. So what you want to do to help with this actual shot pain, there's several things. You can ice the site ahead of time. As I said in the video, you can use a numbing cream like Emla cream. This is lidocaine. You can put about a quarter size smear on this where you're going to give the shot. Cover it with saran wrap, tape it down with paper tape, set yourself an alarm for 60 minutes. And then when it goes off, you just wipe it off with a wet washcloth, prep your skin with alcohol, and give your shot. This should numb the skin completely and you won't feel it. Another option is the Sanara patch, does the same thing, a little more expensive, but works like a dream. It only takes about 20 to 30 minutes to work. And tickle technique. So I think those are all great little tricks that you can try and see what works for you. And then another thing for the long-term soreness, now estrogen isn't something that you typically have a lot of long-term soreness with because you're only giving it twice a week, and you can rotate hips left and right, back and forth. So you're not typically going to have that long-term soreness like you do with the progesterone and oil injections. But if you do tend to get some soreness, you can use a warm compress. I recommend putting rice in a long sock and tying a knot, putting it in the microwave for a minute or two till it's warm, and you can use that ball of rice to massage your site. And that heat, that moist heat, is going to bring more blood flow to the area and help that medication absorb a little bit better and have less knots, less long-term soreness. Another thing to just make sure you absolutely don't forget is that you do need to put that needle in all the way to the hub. Some people get scared and they don't want to put it in all the way, but you risk injecting that medication into the subcutaneous fat if you don't inject the needle all the way and get through that fat layer. If you inject the medication into the fat layer, it's going to cause a lot of pain. It can get really warm to the touch, a little cellulitis, and it's very, very painful if you do that. So do put that needle all the way in before you inject it. All right, that's it.
Awesome. And one thing too, I tell patients along with the heat compress, also if they take a warm shower afterwards, it can sometimes help too, because again, that warmth hitting that injection side is super helpful. But the rice trick and the tickle technique are perfect. Okay, I don't have any other questions that I can see that have come in on anything.
Okay.
If you don't have anything else, then I'll get the next video rolling.
Okay, sounds good. Thanks, Morgan. So the next video we're going to show is on the HCG trigger shot. This stands for human chorionic gonadotropin. It's the final shot before you have your egg retrieval. So go ahead and cue the video when you're ready.
Hi, my name is Laurel, and today I'm going to be showing you how to mix and give your HCG trigger shot. HCG comes in 10,000 or 5,000 units, and your clinic will tell you how much to give. It typically will come in 10,000, and that's what I'm going to show you today. So to start, you're going to have your powder, your liquid for mixing, your needle and syringe combination, and then if you're told to give it subcutaneous, you'll have a little needle that you're going to switch it to before you give it. So to start, you'll take the caps off of your powder and your liquid, and you will take your syringe and needle out. And we typically tell you to mix it with 1 cc. So you're going to put 1 cc of air in the syringe first. And then before you do any of the mixing, you always want to alcohol the top of your vials for safety. You'll pull the cap off, and you'll put this straight into the circle in the middle of the liquid. Push the air in, turn it upside down, invert it, and then you're going to pull back till you have 1 cc of liquid. Now, if you can see the needle in the liquid, then you know you're in the right spot. So pull back on the needle until you can see that tip in the liquid. If you go too far, that's good. You're just going to push the extra air back into the vial until you're at the 1. Reinvert, take it out. Now this liquid is going to go into the powder. Push it all in. Pull your needle out. And to recap, you're going to want to just slide the needle into the cap on the counter. That's the safest way, so you don't poke yourself. This liquid is no longer needed. This is your gold. This is what you're going to give. So just swirl it around a little until it's mixed. You want it to be clear again. And then you're going to do the same thing. You're going to put 1 cc of air in your syringe, put the needle in, invert it, and pull back until the tip is as low as you can get it. So you can pull all of that liquid into the syringe. Push the air in and pull the liquid back into the syringe. Get as much as you can. And if you have a large bubble at the bottom, you can flick it to the surface. And you want to push the air out. Now, if you're giving this intramuscularly, then you're going to want a friend to give it. And this is the site, either the left or the right hip, where these X's are. If you're going to give it subcutaneous, you're going to need to switch the needle. So if it's IM, you're ready to give it. And we'll go through that, and then we'll show you how to do the sub-Q shot. So the IM shot, you're going to have your friend or your partner give you a good pinch in the hip, and you want to pinch super hard because that's going to trick the skin into not feeling the poke. So just pinch real hard, poke straight in, all the way to the hub, let go, inject the medication, wait 3 seconds, pull out, and hold firmly on the skin surface. That's going to stop the bleeding and the medicine from leaking out. After about 30 seconds, check the site. If it's bleeding or leaking medicine, keep holding it until it's dry, and then you're done. To give a subcutaneous shot, you're going to need, I wasn't recapping that correctly. So slide it on the counter, recap, twist it off, and then you're going to get your subcutaneous needle. It's a little 1/2-inch needle. Twist that on. Take the cap off. And then this shot is given in the abdomen. You can pick a spot anywhere you'd like as long as there's no bruise. You want to stay about 1 inch away from the belly button. Squeeze, inject straight in, let go of the squeeze, and inject. Inject the whole medication, wait 3 seconds, pull out, and hold. If after 3 seconds, no bleeding or medicine leaking out, you're done. This will go in the sharps container along with all of your other glass. All done.
Okay. Any questions on HCG, Morgan?
Yeah, awesome. So first question is, so we know that HCG is very time sensitive. Why is that? And then what should a patient do if they give their medication late or early?
Very good question. Okay. So I need to step a couple of paces back and explain what HCG is and how it works compared to like a natural cycle. So HCG it's going to mimic LH, luteinizing hormone, which is in a natural cycle what spikes before you ovulate. So what HCG is doing, if you can imagine all of your follicles, they're growing. They all reach approximately 18 millimeters in diameter. So your ovary sort of looks like a cluster of grapes. Every follicle is a fluid-filled sac. And within every follicle, you have a microscopic egg that's stuck on the inner wall of the follicle. The HCG loosens the egg from the inner follicle wall, so it's free floating in the fluid. So when you go into the egg retrieval and the provider puts a needle into each follicle and removes the fluid, that fluid travels down the tubing and into the test tube and is handed over to the lab. The microscopic egg flows with the fluid and into the test tube. So that is essential for success with your egg retrieval. It takes about 36 hours for the HCG to complete this process. So that's why the timing is so critical. Please give your HCG at the time you're told. If you were to give your HCG too early, too much time would pass by, and there's a risk of the eggs popping out of the follicles and ovulating. They're lost in the pelvic cavity and they can't be retrieved. If you give the HCG too late and not enough time has lapsed, then the egg can still be stuck on the inner follicle wall, and again, we can't retrieve them. So super important. If you do not give it at the correct time, the first thing you're going to do is call the clinic and let them know exactly when you took it. And most likely, they're going to be able to adjust things as needed. Maybe they need to move your egg retrieval time a little bit. Hopefully, they can do something and it will all work out. There is kind of a pretty big window, but we don't want you to take that into consideration when we tell you your time. We want you to give it right on time.
Perfect. I always tell patients to set a billion alarms just so they don't miss it, especially a lot of times the shot can be given in the really early mornings, 1, 2, 3 a.m. So I say set as many alarms as you can to make sure that you are punctual with that injection. What are some possible side effects patients may experience with medication with the HCG trigger or a couple days after their egg retrieval?
So HCG triggers that final maturation of the eggs. So what's going to happen next is you're probably going to get pretty bloated. You typically have a little bit of reprieve after the egg retrieval. The bloating goes down a little, but then about 2 days after the egg retrieval, you tend to get really bloated again. So that's what the HCG is partially responsible for. Obviously, the FSH and that stimulated the ovaries in the first place is a prime culprit for giving you that bloating, but the HCG does make it stick around for longer. So expect to have some extra bloating. You're going to wear your loose pants, loose skirts, that kind of thing, and you're going to be a little uncomfortable. You could have a little bit of nausea. You could have some weight gain. Your clinic will tell you kind of what parameters they want to watch for in order for you to call them. Typically, if you have nausea and vomiting, they're going to want to hear from you, but that's unusual.
Great. And then you kind of mentioned it earlier in your video that it can be administered IM or sub-Q. Is there a difference on why a patient might take it IM versus sub-Q or vice versa?
That is a provider or clinic preference. Our clinic does give it sub-Q, and works very well. Other clinics typically can give it IM, and they're going to stick with that. Another option would be if someone has a high BMI, it would be better to give it IM to make sure it gets into the bloodstream appropriately. It can take too long to absorb with the fatty tissue with a high BMI. Otherwise, I think it's just provider preference.
That's exactly right. We give it IM at our clinic, but I definitely know that there really isn't a huge difference. Again, it's just provider poly preference. I've had a patient who asked if they can mix their medication, the HCG medication, ahead of time because their shot is so early on in the morning. If that's okay, if they can mix it before they go to bed, or how long it can stay mixed, or that you'd recommend it could stay mixed before giving the injection.
That's a good question for your pharmacist. I personally, if you didn't have time to call your pharmacist and ask about that one, I would say don't mix it ahead of time. There's no reason for that. Just get yourself out of bed and get it mixed in time and give it the way you need to. But what do you think, Morgan?
Yeah, same. I say no longer than 30 minutes, honestly. I think I would imagine you could probably mix it longer, but I just don't want any patient or like them second guessing themselves if they mix it incorrectly because they've mixed it and then fell asleep and then given an injection. So I tell patients just to wake up 30 minutes beforehand or 15 minutes and make their medication. So, but I would also probably, like you said, defer to the pharmacist, the person probably a little bit more than I do.
Yeah, and another thing that we do tell patients is if we're instructing them to give 5,000 units, which is a half of that 10,000 unit vial, we'll have them give that dose, and then we have them get a blood draw the next day. And if those levels aren't what we like to see, if they haven't risen the way that they should, we'll have them give that other half of the dose, the other 5,000. So we'll have them keep that in the refrigerator until the next day, just in case they need a little more. So I know it's good. I just think fresh is best.
No, I think also you made a good point too, is if you have remainder medication left over, to always save it. Don't trash it. Right. Just like you said, you could potentially need it if the levels don't look great. Okay, I don't have any other questions I see that come in. Anything else you want to kind of touch base on, any of the medications we went over before we kind of close things out?
Well, I just want everyone to know if you have any questions, please put them in. Any question you have, someone else will benefit from it. So it's not too late if you want to put something in right now. And just want to thank everybody for being here tonight. It's been really fun. I love helping, and I hope that this program is helping you feel more comfortable giving your shots.
Awesome. And thanks, Laurel. One, your story, I think, is super helpful to know that patients aren't alone, especially you can probably relate to a lot of stuff. So that's super awesome that you just shared that. And I do encourage patients to get on and kind of look at your story a little bit more, I think it helps when you know that you're not alone. So thank you again for all your expertise. You are amazing. And thank everyone who joined us via Facebook and Zoom. Thank you all for your questions. Know that we do these videos every Monday again at 7 p.m. Eastern Standard Time. We do different medications every week. Also, these medication videos are available online on YouTube, Facebook, or mymendelsPharmacy.com/pharmassist. And yeah, we look forward to next week. And please, if you have any friends going through this or want to share this out, we'd be more than grateful to have as many people as possible join our videos. So I hope everyone has a great evening and a great rest of your week.
All right. Thanks. Bye-bye.